Hi there, this is Lisa Irving. I'm a clinical psychologist who works in trauma, particularly in work-related trauma. I'm here today with my lovely therapy dogs. They're over there playing, so if you hear any strange noises, it's probably them. It's the evening when I'm recording this, and it's also time for Zoomies. So yeah, we'll just see what happens with them. But if I bring you straight to what I want to share today is something called the impact of event scale. Now this is a screening tool which you can use at any time to just take a little snapshot of where you're at in terms of a specific trauma. So most of the people that I see, it's because they've had something happen at work, either an accident or a significant injury, or they've seen or witnessed something pretty awful. So when I'm seeing them, I usually get them to do a screening tool for this. I'm going to include the URL so that you can have a go at this as well. I've made this in a form designer called Jotform, and you can fill it out and it will give you your results straight away. So let me just go in there. I'm just seeing whether it's letting me actually work on it. Hold on a second. That's the one I want, is right there. Okay, so let's just go in there and I'll just show you. I'll do it as if I'm doing Ruby, my therapy dog, the middle child. I'm going to call her Ruby Woofer. Okay, and then we're going to put her email address in. I'm just going to put one of mine in there. And then her occupation isn't one of those. I deliberately made this form so that it has some of the areas that I tend to work mostly with people. So firefighters, teachers, prison officers, ambulance, police support workers, and medical professionals. I also have mining and construction workers as well, but that doesn't always come up as one of the first responder kind of people. So for Ruby, I'm going to put in therapy dog. And then which best describes you. She's an employee. She gets paid in treats and cuddles. And then you can put in today's date. It's the back to front way for us Australians, but that's okay. And we're going to name the incident that she's been exposed to. So let's just say that she was assaulted at work. That in there, and then we're just going to fill it out. Now you can see here the instructions say between 0, not at all, 1, a little bit, 2, moderately, 3, quite a bit, and 4, extremely. So the idea is you need to choose one of them. So let's just go through as if it was Ruby. So let's say she's thinking about this having been assaulted at work, and any reminders brought back feelings about it. So for most patients, it's something that keeps circulating in their mind. So we might say that that's happening to Ruby a little bit, yeah. I had trouble staying asleep. So often that happens when people are in high distress. You can probably hear the puppies right now. They sound like little Tasmanian devils. Let's say she's doing that moderately. Other things kept making me think about it. So often things will remind you of it. So let's say she said moderately for that too. I felt irritable and angry, maybe a little bit for Ruby. She tends to keep it on the inside. She's such a sweetie. I avoided letting myself get upset when I thought about it or was reminded about it. So a lot of the time people try to push things down and not show people, especially if it's the early stages post the incident. So let's put moderately for that too. I thought about it when I didn't mean to. Say a little bit for that one. I felt as if it hadn't happened or it wasn't real. So sometimes people, particularly if they dissociated or they were in shock during the incident itself, that's usually quite a high one. So we'll just put a little bit for her. I stayed away from reminders about it. Now, I can imagine with Ruby that's exactly what she would do, because she's a bit of a scaredy dog sometimes. So if she had something going on, I'm sure she would either ask to come up to me or she'd hide behind me if there was something that reminded her of it. So I'm going to put quite a lot for that. pictures about it popped into my mind. So this is essentially what flashbacks can be. Flashbacks, they're often thought of as in terms of images, but they can also be other senses. So sometimes people describe having like a smell that brings everything back, or it might be a certain sound that echoes in their ears. Guys, David, shh. Yeah, it's less likely to be a taste, but it can be. And sometimes it's very kinesthetic, like it's a feeling. Like I remember seeing somebody who was sexually assaulted, and she would describe that it was just when people were in her space. So that could be one too. So we're not really sure. I'll just put a little bit for Ruby. Jumpy and easily startled. Here we go. I'm just going to flick through just a little bit more quickly so we can go through to the end. I tried not to think about it a little bit. I knew I had strong feelings about it. She's, a lot more likely to keep feeling about it. My feelings about it were kind of numb. So this is where people might say, how do you feel about it? And you can't really connect with it. So we'll do that for her. And I found myself acting or feeling as though I was back at that time. So often PTSD is like a bit of a time warp. People keep feeling like they're back there, and part of the learning and the reprocessing with EMDR is to help people feel, one, that they've processed it, and two, that they can be more in the present. Often people have trouble with falling asleep and staying asleep. Sometimes people wake up with bad dreams. So having strong feelings about it. Try to remove it from my memory. That's a really common one. So especially when people are coming like 6-12 months down the track, they've often spent a lot of time just trying to block it out and not feel. So I'll put quite a bit there just for interest. I had trouble concentrating as the next one. That's usually quite moderate. Reminders of it cause physical sensations like sweating or trouble breathing, for example. So if she's thinking about that particular dog that assaulted her, let's say it was another dog, she's probably not going to feel too happy about it. The dreams about it doesn't say bad dreams here, but it can be, sometimes the dreams can be bad, sometimes they can be confusing or just weird, whatever it is. So let's do that. Feeling watchful, on guard, I could imagine her doing that if she had been. She's usually pretty passive and lies down on her back when she says hello to dogs at the beach. I tried not to talk about it. That's a pretty common one, so I put that in moderately. So then I just want you to see that down here it says HIPAA compliant. So what it means is that when you submit this, your data is kept safely inside a HIPAA compliant database, which I can see, but nobody else can see or access it. And you get your results. Let's just check that this is true when we do the submit button. So now you can see that it says Ruba Woofa, thank you for completing the impact of events scale. And then if we skip down here, the total score and interpretation is shown below. Now she scored 33, and 33 is just the cutoff where we would start to say, well, maybe this person, or in her case, this dog, is experiencing post-traumatic stress disorder. So it's not a diagnosis, and it is something that I suggest that either you discuss it with your GP and get a referral to a psychologist, or if you already have a psychologist, to talk about it with them. And just see this as a screening tool. And then as you do the therapy, that you can usually see that there's improvement over time. So I hope that's interesting to you. I'm going to include the link so that you can cut and paste the URL into your Google or whatever that you wish to find it. And you can have a go at that. If I can be of any help otherwise, then just let me know. Thank you.